Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What drugs cause tardive dyskinesia? Certain types of medicines that block dopamine receptors in the brain can cause tardive dyskinesia when used for several weeks or more. These medicines include antipsychotics, antidepressants and antiemetics. Tardive dyskinesia is a condition of involuntary movement of the face, torso and other body parts. Examples of drugs that report tardive dyskinesia as a side effect are listed below by class of medication. Antipsychotic drugs. Typical antipsychotic drugs, also known as first-generation antipsychotic drugs, are prescribed to treat schizophrenia. Some of these drugs also treat nausea and vomiting, as well as other conditions. They include Thorazine, chlorpromazine, also used to treat intractable hiccups, tetanus and acute intermittent porphyriaFluphenazineHaldol, haloperidolAdasuve, loxapinePerphenazineOrap, pimozide, used to treat tics in Tourette's syndrome. CoMPro, prochlorperazine, also used to treat anxietyThiothixeneTrifluoperazine, also used to treat anxiety. Atypical antipsychotic drugs. Atypical antipsychotic drugs, second generation, are also used to treat schizophrenia and other conditions such as bipolar disorder. They are less likely to cause tardive dyskinesia than the first-generation antipsychotics, but the risk is still there. They include Risperdal Consta, risperidone, also used to treat autism. Zyprexa relprevin, Zyprexazidis, olanzapine, Seroquel and Seroquel XR, quetiapine, Geodon, ziprasidone, Abilify and Risperdal, aripiprazole, also used to treat depression, autism and Tourette's syndrome. Invega, paliperidone, Latuda, lorazepam, also used to treat depressive episodes. Related questions: why should you not discontinue amantadine? How much does Ingrezza cost and will insurance cover it? Austedo versus Ingrezza, how do they compare? Antidepressants. Antidepressants are prescribed to treat depression and other conditions. They include amitriptyline, trazodone. Antiemetics. Antiemetics are used to treat nausea and vomiting and other conditions associated with the gastrointestinal (GI) tract. These include Reglan, metoclopramide, used to treat diabetic gastroparesis and reflux. CoMPro, prochlorperazine. Tardive dyskinesia treatments. Sometimes, healthcare providers may recommend stopping or decreasing the dosage of the medicines causing tardive dyskinesia. If this doesn't work to eliminate symptoms, there are two brand name medicines available that are Food and Drug Administration, FDA approved to treat tardive dyskinesia. They belong to a class of drugs known as vesicular monoamine transporter 2, VMAT2, inhibitors. Ingrezza, valbenazine, Austedo, dietetrabenazine. What is tardive dyskinesia? Some medications may change dopamine signaling in the brain, resulting in involuntary body movements. The movements of tardive dyskinesia can affect daily life and can sometimes be permanent as a result of medication. Symptoms may include facial movements, such as frowning, jaw swinging, chewing and blinking, finger twitching, feeling restless, pelvic thrusting. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.